he was so aware of what was going on, and his body was just, failing him.
I was in complete denial. I had no idea how to deal with it. I couldn't even mention the word. I couldn't read about it. I blanked out.
Welcome. We created this video to help you care for someone living with amyotrophic lateral sclerosis, better known as ALS or Lou Gehrig's disease. You may not feel prepared for this role, but there are many resources along with a whole community of professionals and ALS caregivers to help you. We'll be looking at the early, middle, and late stages of ALS, and we'll focus on caregiving information and recommendations related to each stage. We will also cover what to expect, how to prepare, and will provide strategies to help you along the way. Let's start with a quick overview. ALS is a progressive neuromuscular disease that breaks down nerve cells in the brain and spinal cord that are responsible for movement. As nerves become affected, a person with ALS experiences muscle weakness and will eventually lose their ability to move, breathe, swallow, and speak. However, they may retain some of their senses, including sexual and bodily functions.
Losing the strength in his arms, his fingers, extremities, just holding his head up. So this whole area has been breaking down.
ALS symptoms typically appear between the ages of 40 and 70. On average, individuals with ALS live 2 to 5 years after diagnosis, with some people living more than 10 years. But keep in mind that the disease can progress differently for each person. Before we get started, here are 5 key takeaways to know as a caregiver. Get support early. This is not a caregiving role that is easy or can be done alone. Connect with knowledgeable medical providers who specialize in treating and managing ALS. Learn about local ALS-specific resources and services. Review your medical, legal, and estate plan preferences and update them as needed. And take time to care for yourself. In the early stage of ALS, people are still mostly independent. They may experience muscle weakness, twitching, or cramping in the hands or feet. There may be increased fatigue, balance issues, and slurred speech. They will need you or a friend to be with them more often for safety. An ALS diagnosis involves ruling out other potential causes of these symptoms. Since no conclusive test currently exists for ALS, individuals may initially receive a diagnosis of probable or possible ALS. Along with these symptoms, receiving a diagnosis can be very distressing. For the newly diagnosed person and for their family, participating in a support group can help ease anxiety and teach proactive coping skills. Individual counseling for you and for your loved one can also be very helpful.
For me, the caregiver support group was critical. That was the one time a month where I could just express whatever I needed to express, and there was no judgment.
Learn all you can about ALS. Start by connecting with medical providers who understand and have experience with the disease. The ALS Association website contains information on certified treatment centers of excellence and recognized treatment centers across the United States. Although there are no cures for ALS yet, there are ways to treat, manage, and slow the progression of symptoms. You may also want to explore current research opportunities where ALS-specific trials are being conducted. If you're related to someone with ALS, you may be wondering if you should get tested. About 10% of ALS cases are genetic. ALS Association certified and recognized centers all have genetic counselors who can provide more information and guide you in this process. Social workers can help connect you to resources and referrals in your community and provide you with supportive counseling. Check with your local chapter of the ALS Association for a referral to a care manager who can provide you with this support. How are you feeling about your loved one's diagnosis? Sadness, anger, fear, disbelief? Perhaps you feel relief at finally having an explanation for the unusual changes you've been observing. All of these feelings are normal.
Once we kind of got over the initial shock, there was real denial for both of us, and I particularly was determined that I was going to prove them all wrong.
As a caregiver, you may experience many different emotions over time. Feelings of loss and frustration can be profound. Two types of loss that are common for caregivers are ambiguous loss and anticipatory grief. Ambiguous loss is the grief we experience when someone is there but not there, when they're not the same person they used to be. Anticipatory grief occurs when we know a loss is coming and we begin grieving before they're gone. In the early stages, it's very important to find support to cope with these feelings, even before you think you need it. Although there is no one right way, there are healthy ways to deal with anxiety, loss, and grief. Writing in a journal can help you to name and express your feelings. Many caregivers find journaling, or writing in general, useful, even therapeutic. Physical exercise, prayer, meditation, relaxation exercises, support groups, talking one-on-one with a friend or counselor, and creating new rituals can help you to stay well and build resiliency.
If I can just sit and read for an hour, I'm very happy. Sometimes I'll say, nope, roast time.
Both you and the person you care for will have to learn to balance ALS symptoms and care needs with the desire to be independent. You both should keep dates with friends, keep up with interests and hobbies, and do the things that fill you with joy. One common question caregivers ask is, what will happen to the person I care for if something happens to me? One thing you can do is make sure your own legal and financial documents are updated. This is also a good time to encourage the person with ALS to make or update their legal and financial arrangements. For them, it's best to speak with an attorney who specializes in disability and estate planning. Key documents to complete include a durable financial power of attorney, an advance healthcare directive, a will and/or trust, and a POST form, which specifies the type of medical interventions wanted at end of life. This is also a good time for the person with ALS to sign a release of information, allowing medical staff to speak with you and others who are closely involved in their care. If you or the person diagnosed with ALS is employed, it's important to contact the Human Resources Department to learn about eligible benefits, such as long-term disability and paid and unpaid family leave options. Securing financial help from the government can be a challenging and confusing process. We recommend seeking out experts to help you early on. Consult with an attorney, a community organization or legal aid office that specializes in Social Security Disability Insurance, or SSDI, and Supplemental Security Income, or SSI. They can also help you navigate Medicare and Medicaid. Most individuals with ALS are eligible for Medicare once they turn 65 years old or as soon as their SSDI benefits begin. But it's important to remember that Medicare does not pay for long-term care, such as care in an assisted living or skilled nursing facility or private care in the home. If the person you care for is a veteran, applying for benefits and enrolling in the VA healthcare system should be done as soon as possible. Your local ALS Association chapter or veteran service organization can offer guidance about service-connected ALS and can assist in completing the necessary paperwork. In the middle stage, a person with ALS may experience severe muscle weakness and even muscle paralysis. Difficulty breathing, swallowing, eating, or chewing becomes harder at this stage. Individuals may also display bouts of uncontrolled and inappropriate laughing or crying, known as the pseudobulbar effect. As symptoms progress, it is common for the caregiver to feel isolated in dealing with new stages of grief and loss. Too often, just when you really need more support, friends and even family may step back due to their inability to witness your pain and your loved one's decline. They may not understand the disease or how to be of help.
But some of my family members reach out more than others, and all I can think of is they just don't know what to say.
Reach out with specific suggestions or ways to be supportive. Contact a social worker for additional resources or to help facilitate a family meeting. At this point, you may also want to bring in outside assistance from friends or hire caregivers to help with care. Consider talking with your doctor or counselor and attending a support group or a retreat designed for caregivers. If you're feeling depressed, anxious, or angry, know that these emotions are hard to deal with on your own. There are effective ways to help you cope and feel better. Don't wait to ask for help. Take a break. Respite can come from a family member, friend, or paid in-home care provider. You can also take moments for yourself throughout the day, even if it's just 15 minutes to drink a cup of tea, watch a funny video, or do something you enjoy. These intentional breaks can make a big difference.
So sometimes when he's sleeping, I just cherish that time that he's comfortable and I can just read or do nothing or sleep.
And if you need more time off, there are out-of-home respite options, such as adult day programs or a short-term stay in a 24-hour care-assisted living or nursing residence. Too often, caregivers don't feel they need a break until they experience a crisis or problem with their own health. We encourage you to get respite early and as often as you can. Some signs that you need more support and time to take care of yourself include health issues like a rash or ache that are getting worse, rising blood pressure, your own chronic health conditions aren't being managed well, you're experiencing trouble sleeping, feeling anxious, irritable, and less patient, turning to alcohol or drugs in an effort to relieve your stress. Remember, as ALS progresses, it's easy to postpone your own healthcare needs. Be sure to prioritize your physical and emotional health. It may cause you anxiety to take time for yourself because you worry something bad will happen, or you may feel guilty. The truth is that it's essential to confront these concerns and make time to step outside of the caregiver role. Because ALS causes loss of motor function over time, it's important to identify potential hazards that may exist in the home. A physical therapist or PT can complete an in-home safety evaluation and suggest modifications such as bathroom grab bars for getting in and out of the shower. PTs can also recommend other types of equipment and strategies to prevent falls and injury. An occupational therapist, or OT, also helps promote independence and safety for the person living with ALS. They can suggest assistive devices and tips to help with daily activities and personal care. People with ALS may experience difficulty speaking, swallowing their food, and drinking beverages. This due to the weakening and loss of control of the bulbar muscles in the mouth and throat. A speech therapist can make recommendations to help manage speech and swallowing. They can also recommend devices that allow a person with ALS to communicate in a variety of ways. Those who lose muscle control in their hands and arms will need assistance eating and drinking. They may struggle to maintain a healthy weight and proper nutritional intake. A dietitian can help put together a diet that provides for their specific needs. Over time, a person with ALS may no longer be able to safely swallow food or liquids, and a feeding tube may be needed. Palliative care helps to improve the quality of life for people who have debilitating chronic health conditions. A person doesn't have to be in the end stages of a disease to qualify. Palliative care teams can help to manage symptoms and reduce suffering. Contact the medical team for referrals to any of these services, and if it's difficult to attend an appointment in person, ask providers about telehealth or virtual visit options. In the event that your health insurance does not fully cover the cost of a necessary piece of durable medical equipment or communication device, Most ALS Association local chapters offer equipment loan programs. Now let's talk about late-stage ALS. This is when the person will need assistance with most of their personal care. Their mobility will be extremely limited and respiration becomes more difficult. Speaking, eating, and drinking may not be possible at this stage. Respiratory difficulties that progress over several months can become challenging to manage. However, there are medications to help relieve discomfort.
So on one sense, you want to take it one day at a time. On the other, you really need to be a little bit ahead and prepare.
Talk with the medical team about all the possible ways to help reduce pain or suffering and increase comfort. Remember, you are your loved one's connection to quality care and services when they are no longer able to advocate for themselves. There may come a time when the person with ALS requires a higher level of care than can be provided at home. Moving the person to a skilled nursing facility can be a tough decision, but a necessary one for some. You may feel like you've failed or that you're breaking a promise, even when you know that placement will provide more safety and advanced care.
I would get to the point where I couldn't take it anymore before he couldn't take it anymore. And that was a very haunting thought for me. So that was our goal, to try to keep him home as much as possible.
If you're considering a nursing facility, it's helpful to get a list of local options and be sure to visit.
He did not have to go into a skilled nursing facility. We came close that might have been a possibility, but he passed away before then.
Even if the individual moves to a skilled nursing facility, this doesn't mean that your role as a caregiver ends. Your presence and advocacy will help to ensure that proper care is provided. Hospice services are designed to support individuals towards the end of life. Care can be provided wherever the person resides, whether at home or in a care facility. This includes visiting nurses, pain management, and personal care. Hospice can also provide spiritual, grief, and bereavement support, as well as respite for family caregivers. Hospice is a Medicare benefit that individuals are eligible for when a doctor has determined a patient has 6 months or less to live. You can ask the doctor for a referral to begin services. Find out more about all the topics addressed in this video through the accompanying ALS resource guide, by speaking with the person with ALS's medical team, and by contacting your local ALS support organization. Finally, we want to remind you of these very important key takeaways. Get support early. Connect with ALS specialists. Identify local resources. Review your medical, legal, and estate plan preferences and update them as needed. And take time to care for yourself.
We're just two peas in a pod. We're complete opposites. But, I can't think past him.
We want to thank you for viewing this video, and we hope the information included here will give you a starting point for questions to ask and resources to request, so that you feel more informed and supported in your caregiving journey.